Good morning and welcome to our CTSC Spotlight series. This is a monthly initiative that we have started to kind of showcase our services and offerings at the CTSC, but also invite some special guests that work alongside us and are experts in their field. Today, we are talking about tools to aid in recruitment and retention in our clinical trials and recruitment efforts. So I'm Laura Parent. I am the Director of Strategic Partnerships and Research Development. And alongside me today, we've got Jerry Tribout, our Manager of Research Recruitment. And we've got Heather Tribout, our guest speaker from UH, who also serves alongside us in the CTSC. But before we get into those introductions, just quite briefly, would love to just again give a high-level overview of the CTSC. We are a consortium of 7 institutions with our community partners. So Case Western Reserve University, University Hospitals, Cleveland Clinic, Metro Health. We've got NeoMed, the University of Toledo, and of course the VA of Northeast Ohio. Alongside all of that, we work to develop our resources and services, funding opportunities through NCADS, NIH. We've got community engaged research opportunities. And really our goal is, harnessing our research powers to train the next generation of researchers and provide consultations and opportunities to enhance our research with the tools necessary to succeed. So education opportunities, programming, and a whole lot more. So I would love to give it over to Jerry. He's going to introduce our guest today. This is his specialty, and give a little introduction about himself and the services that he provides through the CTSC. So Jerry, good morning.
Thank you very much, Laura. Hello, everyone. My name is Jerry Tribout. I am the Research Participant Recruitment Manager at the CTSC of Northern Ohio. I joined the CTSC in September 2024, and prior to that, I worked in the University Hospital's Clinical Research Center for about 6 years. Throughout my time in the CRC, I had the opportunity to work with Heather on multiple research studies where we introduced many new services and tools researchers can use to efficiently recruit and conduct their studies. I thought it would be a good idea to invite Heather to speak about some of these tools to spread awareness about some of the resources study teams can request from the CTSC through Spark. So with that said, I will quickly introduce Heather and hand it off to her. Heather is the manager of the Research Support Corps in the University Hospital's Clinical Research Center, and she serves as the UH administrator in the Resources and Services module here in the CTSC. Heather has over 13 years of experience supporting investigators with essential resources and expert staffing to streamline and innovate study design and conduct. Heather, if you have anything to add, feel free, and the floor is yours.
Thank you, Jerry. Hi, everyone. I'm Heather Tribout. I'm the manager of the Research Support Corps within the UH Clinical Research Center. And just a summary of our resources available. We're like a float pool of different research resources available to investigators throughout our institution and also our community. We have research nurses, coordinators, regulatory, FDA regulatory, monitoring data, and also the UH Mobile Research Unit. And we can support any research project, investigator-initiated, industry-initiated, any funding source, and pretty much if you have a hypothesis or an idea, bring it to us and we can make it happen. And we partner regularly with the CTSC to help investigators identify additional resources and funding sources to support their research. With that, I'm going to slide. You see that?
Yes.
Yep.
We see presenter mode.
Sorry, I'm on 2 screens. You see it now?
Yep, there we go.
Yep.
Okay. All right. So today I'm going to talk about tools and different resources to aid with your research recruitment and retention. So I just wanted to provide some background information for how some of our research processes and research has changed, and pretty much the catalyst that drove many of our research innovations and strategies came from the COVID-19 pandemic. COVID has changed the way we conduct research. We had to quickly implement new strategies and processes to continue our research efforts during the pandemic. And most of us, we had to stay home. So how do you conduct research from home, right? We had to get creative, and we developed electronic consenting, even self-consenting studies. So that came from the idea of when you go to different websites and you see these pop-up boxes, how do you get patients or participants enrolled in research when it's just a data collection or survey study without having a coordinator physically present? How can we get them that information to be able to self-consent and decide to participate, which we started to do that. We also did telehealth, virtual health visits. We also would do home health study visits. So when we had to collect samples but couldn't bring patients here on site, we would deploy our nurses and coordinators out to the patient's homes. And then for communication, we integrated with our RedCap platform, the Twilio third-party automated texting and voice calling services. And that not only helped us schedule and have ongoing communications with our participants, but we could also send them follow-up surveys. And then for permanent changes for the pandemic, it helped increase access to care by normalizing research. So we truly believe that research should always be a treatment option and available to all patients, regardless of why they're coming here. Another permanent change, we saw a decrease in health disparities because of the different innovative solutions that we brought during the pandemic. So before the pandemic, a lot of our research was limited to our main campus location because of our academic affiliation with CASE. But when we're all stuck at home during the pandemic and we still had to, get research out to our participants, we were able to reach a much larger volume of patients, but also, a more diverse population. We also are able to meet patient needs through some of the technology and tools we've developed, and then ultimately we improve recruitment and retention. So now I'm going to talk about some of the different recruitment and retention strategies. This is the high-level overview. Epic EMR tools, we have Trinetics, the mobile research unit, eConsent through either Part 11 compliant platforms or RedCap. Mailing flyers, emails, phone calls, the automated text messaging and voice calling, short codes, long codes, social media, the websites and different landing pages for intake forms, physician referrals, community partner referrals, recruitment events, third-party recruitment services, and then centralized recruitment databases. And we're going to dive into some of these strategies in the upcoming slides. So just some tips for regulatory strategies when it comes to recruitment. Don't limit yourself. So when you're designing a study protocol and a recruitment plan, consider every possible situation that may come up. Take into consideration your patient population, right? If your study's enrolling elderly, I would think about how does that population typically communicate? Do they prefer voice calling, face-to-face? Are they tech savvy? Do they know how to use apps? And I would incorporate that into your recruitment plan. I would also use different methods such as flyers, clinician referrals, and digital advertising, because if you can get all of these strategies and materials submitted to the IRB up front, then you can quickly implement these if you're struggling to recruit and enroll. And then it also allows participants to reach your study team with multiple modes of communication, and then it will be in the comfort of their own home. We also do QR codes. So if you have flyers, just make it very user-friendly, because we know some patients will not pick up the phone to call us, so we need to figure out how can we get them to our study team. And like I mentioned, consider digital methods when trying to recruit the younger populations. For older populations, maybe in person or phone calls or snail mail flyers. And then you can use community-based resources for the underserved population. Replace the medical jargon with lay terms so the participants can understand the purpose of the study and why it's important for them to enroll. And strive for cultural sensitivity when trying to reach populations from culturally diverse and underserved backgrounds. So recruitment data reporting tools, and this also is for study conduct too, but we have Trinetics, and Trinetics can query electronic medical records from multiple institutions. And here at UH, we've used this in the past for study feasibility and even patient recruitment. So for patient recruitment, we can query using ICD-10 codes for diagnoses, encounter types. We can look at lab codes, medications, procedures using the CPT codes, demographics, and vitals. And for recruitment purposes, study teams could submit a request to the IRB to ask for an export ID, which is basically a patient list that contains some of the PHI, and they can query the UH EMR for potential participants that might be eligible for the study based on inclusion and exclusion criteria. And this is approved with the HIPAA waiver from the IRB, and then the list can either be used to approach the treating provider if it's not, if you're approaching from outside the PI's clinical practice, or you could also get IRB approval to send the study invitations directly to the participants. And then Epic EMR query tools, we have Slicer, Dicer, Caboodle, and Cosmos. UH is newer to Epic EMR, but we are starting to implement some of these tools in our research practices. And then innovative digital solutions. RedCap eConsent has been amazing. We use that for our COVID long hauler study that enrolled over 1,000 participants. We also use the ClinCard and Lyft platform, which is by Greenfire. If you work with industry sponsors, you may have worked with ClinCard in the past. Some of our industry sponsors use the platform. University hospitals, we now have our own platform that we can build for our investigator-initiated studies. So the benefit of that is providing participant compensation and reimbursement with reloadable debit cards, but also the Lyft integration has been instrumental in providing transportation to research participants that may not otherwise have access to our site. We also use Twilio, which is an integration with the UH RedCap platform. That's the third-party automatic voice calling and text messaging, virtual and telehealth visits, and then the mobile research unit. Let's talk about RedCap. So RedCap, although it is part 11 compatible, it's not Part 11 compliant. So
can you go back and talk briefly? There's a question about the ClinCard. I don't know.
Oh, sure. I can we pause on that until I get to the ClinCard section?
Oh, sure.
Maybe.
Yep.
Okay. But yeah, send all the questions in the chat and then let me know. We can get to it. I'm going to go into most of the methods in detail. So RedCap is Part 11 compatible, but not Part 11 compliant. So for university hospitals, at least, we can use RedCap eConsent for non-FDA regulated research. So for observational survey studies, we've been able to use the RedCap eConsent, and by doing so, it improves efficiency and compliance. So not only does it help us enroll large volumes of patients if we're, our enrollment goal is 1,000, but it's also, it makes it easier when we're doing a virtual or telehealth visit to get electronic consent, right? It also increases accessibility to research studies. That also increases enrollment and diversity. So for eConsent, you not only can use it in a virtual telehealth setting, but you can also use it on a mobile research unit, in the satellites, or in the community sites. It allows flexibility to bring the research consent process directly to the patients no matter where they are. It helps foster collaborations with other institutions, satellite sites, and community partners. And then it's a very standardized process to efficiently collect a large volume of data much more quickly. So it reduces the overall coordinator time for the consent process. And like I mentioned, eConsent can be used in multiple visit types. And then we also derived a self-consent, implied consent process using the RedCap eConsent module. And so for that, it's basically a self-consenting instrument and process to allow patients to self-enroll under an implied consent model for observational studies at their convenience. So we've been able to do this for COVID long hauler patients, and it was an outcome survey study. And to access the study itself, we set up the Twilio integration so patients could text a code to a certain number, and then RedCap would do the rest of the work for you. It would send them the intake form, the informed consent hyperlink, and then the surveys if they decided to proceed with consent. So it automated the entire process, and the study coordinator did not have to consent them or collect the data. Now we're going to talk about the mobile research unit. The mobile unit launched in 2021, and the goal was to expand accessibility of research opportunities to rural areas and underrepresented communities, and with the primary goal of increasing enrollment and enhancing diversity. It's the first of its kind, and I believe still the only one of its kind in Northeast Ohio, and it's a 39-foot Winnebago that has 2 private exam rooms fully equipped for site procedures and lab processing. The exam rooms have a full-size exam table and an oversized phlebotomy procedure chair. They have sinks in the rooms, all of the standard clinical assessment tools on the wall, like the Welsh-Allen kits for vital signs and physical exams. And then we also have refrigerators and freezers with continuous temp monitoring. We have one refrigerator that's capable of temporarily storing investigational products. There's another refrigerator in the lab area for specimens. And then the front exam room has a refrigerator for patient food and beverages. And then underneath the mobile unit, we have capabilities of storing a portable -80 freezer for specimens or for investigational products. The unit also has a private Wi-Fi, so we can use our hospital-provided laptops to see patients. We can also use it for iPads, for consenting and surveys. It has a wheelchair lift to make accessibility to the unit easy. And then it has a restroom, which is essential for collecting specimens. And then the unit as a whole provides our physician scientists the ability to engage in clinical research across our community and satellite sites without needing to come to main campus. And like I touched on before, the mobile research unit is designed to support the patients and our community by increasing accessibility to the latest treatment and diagnostic opportunities available through our clinical research studies. The unit also benefits our investigators by increasing the number of research opportunities, and this is done because we're able to expand our resources and staffing across multiple sites instead of limiting it to main campus or a select few satellite sites. And it also benefits our sites and community partners or even other academic collaborators because we can stand out by having these resources available to support patients across our region. This is a little blueprint of the mobile unit. And I believe there may be a video, like a virtual tour available too. Gary, if you have the link, can you put it in the chat if you're interested? If not, that's fine too.
I have a link that I can throw in the chat. Yep.
Oh, thank you.
Yep.
So it's a little bit snug in the waiting area, but that is our lab, restroom, and then 2 full-size exam rooms. So the availability of the unit, we manage that here in the UH Clinical Research Center, and it's, like I said, it's available to anyone in our region, not just university hospitals. And later I can put in the chat a request for the mobile research unit if you're interested. Basically, the study teams, you can submit a request to utilize the mobile research unit. We'll review your request, including what type of project, so we can support preparatory to research and clinical research projects. We'll look at the location, different staffing requirements, and then we'll develop a budget for you. And the nice thing about working closely with the CTSC is there's funding opportunities available to those who may want to use the mobile research unit. So we can work with you to identify, staffing and resources, but also identify funding if that's needed. And then to deploy the mobile unit out to different sites, our team works with the local necessary approvals from fire safety, police, and facilities to make sure that we are parked in an appropriate area, not blocking fire lanes, and still ensuring that it's safe for the patients boarding the unit, but also safe for maybe patients passing by the unit because of the diesel exhaust. And like I said, there's CTSC voucher program and core utilization pilot grants available to support the use of the mobile research unit. So if you have an ongoing study that maybe is struggling to enroll, or even a new study that you want to build this into your grant, please reach out and then we can help look at your request and figure out the best way to proceed. Cling card, I think there was a question about this, so hopefully I can answer some of the questions. What's Cling Card? It's a platform through Greenfire, the company, and it's an automated workflow that provides real-time payments for participant compensation, travel reimbursements, and it has a Lyft rideshare integration. And enhances research engagement with the participant retention because it has built-in appointment reminders and electronic communication. And what's nice is it has flexible payment methods, including a reloadable debit card, which is a physical debit card. And I think they are good for 3 years, so they don't expire as quickly as some of our gift cards that we purchase. It also has a virtual card, so tech-savvy participants can choose just to have a virtual card on their phone, and then all the payments are loaded through that. And then the participants can also set up direct deposit through the Cling Card portal, so they can get all their payments right to whatever bank account they choose. And the platform also ensures IRS tax and HIPAA compliance. So the benefits of using Cling Card for recruitment and retention is it provides flexible real-time payment options. The reloadable debit cards and virtual cards can be issued and be used at any location. So for our studies using the mobile unit or out in the satellite sites, it's a safe and secure way for coordinators and nurses to travel with these methods because they're empty before you issue the payment. So it's much safer than trying to travel with a large amount of cash. It improves efficiency and security by eliminating the need for checks, cash, and multiple gift cards. And then the Lyft rideshare integration is unique. It allows our coordinators or the participants themselves to request rideshare services right within the Cling Card platform. And it removes the financial responsibility from the patient. So the actual Cling Card or Lyft rideshare charges get charged right to the main Cling Card account and not to the patient. So they're not having to wait for travel reimbursement. We can book their travel from our site to their home to a satellite site, pretty much anywhere they wish. And then the built-in appointment reminders and electronic communications can also enhance engagement and retention if you're not using other methods like Epic or RedCap. Are there any additional questions for Cling Card? I can stop for a second to answer.
Feel free to unmute or drop them in the chat.
Oh, okay. All right, so Twilio. So Twilio is a third-party platform that integrates with RedCap. It's a cloud-based communication platform, and it's aimed to improve communications and engagement with research participants. So we've used this to automate texting and voice calling for research invitations and for research surveys. So, for example, if we receive a list from our Kinetics team or EMR team, and we want to send out a general, hey, Mr. Smith, you're potentially eligible for XYZ, we can use Twilio integration to send out those invitations. We can also use Twilio in a way where we can generate short codes, text COVID 55555, and then that can automate the intake process to get them right to our study invitations webpage through RedCap. It's highly customizable, so I know the text features used across most studies, but for the older population, it also has a voice integration. So your participants can either respond to surveys using their phone, or they can use the keypad. So just like when you call a doctor's office, press 1 for yes, 2 for no. Twilio can do all that for you, and all the responses are saved directly in the RedCap platform. It also has an integration with Microsoft Office 365, and there's going to be a potential to integrate with Epic EMR in the upcoming years. And these are just some of the use cases. Like I said, we've used this for our centralized COVID database, and this connected participants directly to the different study teams conducting COVID research and improved retention and engagement for all of our COVID-19 studies. So they would, on our different recruitment flyers or platforms, web pages, we would have the text study to 440 number or call the number, and both methods would link right to our REDCap intake form for participants to express their interest in participating in a COVID study. We've also used the automated text email invitations to connect patients to actively enrolling studies. So we had over, this data is old, so it could be different now. It was a couple years old, but at the time when we used the Twilio integration, we had over 85,000 unique patients diagnosed with COVID, and then 54,000 received information related to our COVID initiatives here at UH. And we had an opt-out built into this invitation, and less than 300 participants unsubscribed to that communication, which I think is significant. Compared to other different communication platforms or ways to contact participants, I think this was very well received and successful. And because of that, over 2,500 participants enrolled in a COVID research study at university hospitals. So we were able to push out a general invitation to 54,000 people, and we had over 2,500 people actually enroll. Any questions about
Before you
Twilio?
move on, we got a question in the chat from Elena Wright. She asked, do you charge / what do you charge per study for Twilio usage?
Okay, so Twilio usage is really dependent on the types of services you're going to enable in the REDCap platform. There's pass-through costs for text messages, which I believe are $0.01 per text, incoming and outgoing. So you would have to calculate how many texts you want to send and receive for your study, include a little buffer. And then for the Twilio application itself, there are monthly service fees associated for the number of users in the project and then duration of the project. In our experience with using the Twilio platform in REDCap, it not only reduces or eliminates the need for a study coordinator, but it significantly reduces the budget. So if you have an existing study using a study coordinator, for the most part, that the funding can be reallocated to the Twilio platform, and you'll be left with money. If that makes sense. So it's more cost effective to use the Twilio platform than to have a coordinator make phone calls, see patients face to face, or manually push through these communications to the participants. So if you're interested, you can reach out and I can send you a draft budget, but the costs are nominal. I would say the service fees for Lyft are maybe $20 a month per study. And then obviously the costs associated with providing the compensation, the travel reimbursement, and then the Lyft rides themselves. I would budget the IRS business rate for mileage reimbursements, which I believe should equate to some of the Lyft costs. And then the compensation would be outlined in your IRB approved consent form. And then for the short codes and long codes, those are a little bit more expensive. You purchase a phone number monthly, which I believe is $1 a month, not too bad, but the short codes and long codes can get expensive because you have to register them with the different cell service providers. So it has to go through a different approval process. So we do have workarounds for that. But like I said, if you want a budget or if you're curious about the different capabilities of Twilio, you can reach out and we can try to show you some of the demos. Any other questions about Twilio? All right, Epic. So for Epic EMR, there's a patient portal, and this can be used to identify potential patients meeting your eligibility requirements via the reporting workbench. And within the workbench, you can access the list and then send recruitment requests through each patient's MyChart. This is just a screenshot of what it looks like on our end. so for Epic, it also has a recruitment alert, and you can identify patients using best practice advisories, and it uses a rule-based decision to support different tools in Epic, and you can customize these tools and the reports based on your eligibility criteria, and then different clinicians can be alerted that their patient may be potentially eligible for a study. So if your physicians are seeing patients in clinic and the study coordinator enabled this alert, Dr. Jones will say he may be seeing a patient for this insomnia study, and when he goes into Epic to do his documentation of the visit, a box will pop up and say, hey, your patient that you're seeing right now may be eligible for this potential study. And this can help facilitate the recruitment process as well. And here are some of the other Epic EMR research tools being used across different sites. There's a ConMed indication warning that can pop up when they're ordering different medications. So if your study prohibits certain medications, or maybe you want to be notified or have the physician notify you before prescribing something new, you can have this warning pop up. And then there's also the electronic informed consent form. I know some institutions are still working through the logistics of utilizing this feature for FDA-regulated studies because Epic EMR is not Part 11 compliant. It's, I believe, compatible or capable of being compliant, but it's not compliant because most of our EMRs are not Part 11 compliant because of where the data lives on the servers. But similar to the Red Cap, the patients can sign electronically using a signature pad or right in the electronic medical record. And then data capture smart forms. So if you need additional information, you can work with your IT team to build smart forms specific to your research study. You could do this for eligibility criteria. You could do this for study visits. You could even create patient-reported outcome questionnaires and different surveys or tools using these forms. I do believe there are quite a few validated surveys or instruments available through Epic, so I would check with your IT team first. I know some of our clinicians are integrating some of these tools in their clinical practices just so they can collect more clinical information and then maybe down the road implement a retrospective research study using the patient-reported outcomes or surveys collected in these smart forms. And then for at least UH Epic EMR, Care Journey is coming soon. We just found out about this, I believe, last week. And basically, it's a patient-facing portal within the Epic MyChart, and it contains a comprehensive overview of research studies that the patient's enrolled in. It will include a very brief description of the study that they're enrolled in. I believe it's customizable, so the study coordinator or nurse can submit a request and then have IRB-approved language in the study description summary. It also has a button for the patient to click contact study team, and then those messages will go right into the study team member's Epic in basket. And then it can also link upcoming study appointments and other information if you wanted to include, for example, if your patient's admitted to another ED or hospital, you could maybe have a pager number or a call number on that study summary page so your patient knows how to get a hold of you if they are seen outside of your institution. Any questions about the Epic features? Nope. Okay. So we're going to move on and talk about centralized registries and databases. So the CTSC is implementing a volunteer registry, which is a free study recruitment tool that will connect potential participants who signed up to be connected to potential research studies. So if you have a study that is looking to enroll a large volume of patients or maybe a special population or is just struggling to enroll, you can reach out to Jerry in the CTSC and they can query the volunteer registry. So it's a list of potential participants who said, hey, yes, please contact me if a new study comes up that I may be eligible for. And then it contains limited information about those participants that they can query, and then send you their contact information to reach out about your specific trial. And then coming soon, the CTSC is putting together a clinical trial finder, and this will be similar to the different clinical trial finders utilized by some of our sites, and hopefully it'll connect all of our CTSC sites, so patients across Northeast Ohio can query or search the clinical trial finder app at a more local level and identify which of our CTSC sites are recruiting for different diseases. And basically that will be modeled off of our ct.gov process, but it'll be limited to our local CTSC, so University Hospitals, the VA, NEOMed, Toledo, Cleveland Clinic, and Metro. Now we're going to talk about some retention strategies and solutions. So patients first, right? How can we know how to recruit patients, and I think some studies struggle to actually retain them, especially if they go on for a long period of time. So what can we do to help retain our patients? Flexible study arrangements. So think about if you're a patient or if it's your family member, how can we make participation easier, especially if the visits are more frequent than standard of care. So we can try to bring research visits directly into their home. We can do telehealth virtual visits. You can utilize a mobile research unit. You can also do electronic surveys, or even some studies now are doing self-collection of samples. So they may send home or mail lab kits to the participants, and then the participants can send their samples right back to the study team. Ongoing engagement is very important. I know a lot of participants, they want to feel involved in the study, and they do appreciate when you can provide them with study updates such as newsletters or how enrollment's going across the nation, or maybe if your site is the first one in the U.S. to enroll, if you can share that with your participants, they're more than appreciative. I think it helps engage them and make them feel like, or let them know that they're actually making a difference in healthcare medical innovation. Electronic communications are very important. Everyone's attached to their cell phones nowadays, so if you could utilize text messaging or even push notifications through Epic EMR, just staying routinely connected to your participants will help engage them and then also ensure compliance with the protocol. We've also seen studies do raffle drawings for prizes. So if your study is going on for 3 years and maybe the visits are not frequent, or maybe it's mostly virtual telehealth visits or self-surveys, how can you engage with your participants so they remember that they're a part of the study before it's time to do their surveys? You can implement raffle drawings for different prizes. So, for example, 10 participants this month may receive a prize because you're still enrolled, or because they completed X number of surveys, things like that. And then when a study is completed, participants really love receiving study results. So maybe if you can't disclose study-specific results, if it's a blinded study and your sponsor won't unblind at the end, just overall study results. Hey, this is how the trial went. If the results are up on ct.gov, just letting your patients know, like, hey, this is where the final study data lives, and this is the impact you made by participating in the study. That is it. Any questions or anything you want me to go into more detail?
Jerry, do you want to elaborate more on the registry?
Yeah, so the registry is a resource that we launched very recently. So we're still working on filling it up with registrants. But the idea is to engage with different communities and really build out a comprehensive resource filled with a large volume of potential participants based on different demographics or conditions, topics they may be interested in. So CTSC members can request to tap into that registry and efficiently recruit for their studies. at different health events, we will go and engage with these different communities. And we have resources to link them to this link tree here where they can sign up to our volunteer registry. And there's also different resources to schedule a standard of care clinic visit at any of our partner institutions as well.
Gary, do you also?
Laura, do you have the
Okay.
link to that? We can throw it in chat so people can look at it if they would like.
Yes. Yep. Why don't you talk about some of the things we've been doing also out in the community with
Yeah. Recently we have purchased 2 point-of-care lab machines to provide different communities with lipid panels and A1C and glucose screenings. So we will work with different nonprofits, community organizations, provide their communities with these finger prick lab screenings. It takes about 5 minutes to result them, and basically the idea is to just get them engaged in their healthcare, connect them with research opportunities, get them interested about their health, and engaged with the CTSC resources. If anybody has any ideas for communities to engage with, people to partner with, feel free to let me know, and I'd be happy to reach out and work with you to provide screening events for these populations.
So, Kim, I see your question in the chat here. Any connections with people living with disabilities interested in research? We have done a few workshops in the past. We recently did one, Down syndrome awareness, and trying to actively recruit people with Down syndrome into clinical trials. And so we had a lovely workshop with the Northeast Ohio Down Syndrome Association, talking about that. And so if you have any recommendations of any specific populations that you're looking for, that's something that we can certainly work with and try to connect you with as well. But yeah, we certainly have done that in the past. We also, a year prior, did LGBTQ inclusivity in research participation as well. So always trying to find new and different ways to engage unique populations. And then Casey says, are there any strategies to address getting participants to update their health information as time goes on after their initial sign up for the registry?
Yeah, that is a great question, Casey. We have thought about that. We are thinking through different strategies to make sure everything is up to date and current, but we have not cemented any process yet to ensure that happens timely. Looks like we received another question. Can Case Western investigators use Trinetics to recruit, even if they do not have a clinical appointment at UH, CCF, etc., but they are targeting a clinical population in research? If I'm getting started with using the CTSC volunteer registry for the first time, should I use Spark request for an initial consult? Specifically interested in recruiting people with Parkinson's disease. Yes, so there is kind of multiple questions here, so I will take them one by one. Can CWRU investigators use Trinetics to recruit even if they do not have a clinical appointment at UH or Cleveland Clinic, but they are targeting a clinical population in research? I think that largely depends on your IRB. If it's a Case Western IRB submission and you did not explicitly state that in your recruitment plan, I think you will need either a modification or maybe even a different IRB submission at the institution that you're trying to reach patients from. So if you're trying to reach UH patients, the UH IRB may come back and say that you need a UH IRB to reach those patients. If you have a specific study that you're currently trying to recruit from, if you want to reach out to me, I can help you kind of work through that process. And the
Yeah.
second part of the question, sorry.
Yep. And yes, to submitting a Spark request for initial consult.
Yep.
Yep. So we actually will have that linked here at the end if for those interested in submitting a Spark request. We also wanted to take a second to plug our podcast. One of our recent episodes talked about relationship-based recruitment and getting into the community with recruiting special populations. So Dr. Heather Tribout was our guest, with Jerry as well as the host there. So taking on multiple and wearing multiple hats within the CTSC. So that is exciting as well. And just kind of as we wrap up, some important links. So if you would like to submit a Spark request for recruitment services, to connect with the TIN, to connect with Heather, any of the following, please submit a Spark request for those recruitment services. And that's kind of the quickest way we can get you there. And if you are confused about how to submit a Spark request, we can help walk you through that as well. We have next month our Spotlight series focusing on a unique study and some engagement opportunities kind of outside of the normal baseline, I guess. Dr. Julia Blanchette from University Hospitals will join us on April 8th. So we'll have more information on that soon. We'll send out a link following this seminar as well. And then, of course, become a member of the CTSC to stay up to date with events, funding opportunities. And if you have any questions, feel free to reach out. But thank you all. This will be recorded so we can send that to you as well once it's all processed after our conversation today. So unless there are any other questions for Heather or Jerry, we appreciate your time and hope to see you at the next Spotlight series or other CTSC webinar. So thank you so much.